Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast as part of a Newspart interlude. This audio podcast as part of a Ztorm and Squala. This audio podcast as part of a Ztorm Logistics production. Through this audio podcast, this Newspart interlude, this Ztorm Newspart interlude, a look over, look over, I look over it. I look over some detail in at least some in at least some detail relating regarding the a document that had been published from the organization, the professional organization, the Institute of Biomedical Science, IBMS in the United Kingdom, and where in part of the in this doc sorry in this document that have been published by the IBMS. There's a look at there's a look at sort of some aspects of the healthcare science or laboratory medicine workforce, and looking at the scientists, the healthcare scientists, or the laboratory medicine specialist workforce in regard to healthcare, services, in regard to healthcare services. And so this the public the document is available through the through the IBMS and the or part at least part of the detail is in regard to sort of the backdrop, the sort of backdrop, aspects of the backdrop relating and regarding the healthcare scientists, sort of workforce, the workforce, and the laboratory medicine, laboratory specialists sort of workforce. So scientists or biomedical scientists, in context of the Institute of Biomedical Sciences, is one of the longest established regulated healthcare professionals, having been regulated by statute since in around 1960. They also form the largest professional organization within healthcare science in around 40%, and account for more than 27,000 of the healthcare of the Health and Care Professionals Council, or HCPC, registrants. Biomedical science is also the largest staff sort of organization, staff sort of workforce organization in the United Kingdom. At least, for example, in regard to pathology laboratories, approximately around 14,000, with the remainder in sort of management posts. NHS blood and transplant, NHS blood and transplant, NHSBT, public health services, for example, the UK Health Security Agency, or UKHSA, private laboratories, research, and in amongst diagnostics, in where industry, in regard to industry and diagnostics, as part of academia. Scientists or biomedical scientists also make up the bulk of pathology bulk of sort of pathology, working alongside smaller numbers of medically qualified pathologists, and in some departments of laboratory divisions, a small number of clinical scientists, and are supported in most laboratories by upregulated laboratory support staff. So, for example, medical laboratory assistants, or MLAs. The biomedical science workforce has extensive experience of both NHS National Health Service laboratory management and advanced clinical practice, and a vast vast sort of knowledge and experience of experience in around specialisms sort of aligned to or linked to hematology, transfusion sciences, clinical chemistry, microbiology, cellular pathology, immunology, molecular pathology, and genomics. The broadest knowledge base of all healthcare professionals, from before conception to after death. This is the workforce. This is the workforce with the capacity and capability to respond to large and rapid increases in demand for laboratory investigation, laboratory testing services generated. It's also the workforce with the capacity and capability to undertake advanced clinical roles and to enable them to report histopathology, for example, histopathology samples alongside medically qualified pathologists, helping to support in context of diagnosis, screening, and to meet the challenge of early treatments of and as per conditions strategy. In regard to the sort of in regard to the sort of the workforce in workforce and work for advancing the IBMS is the UK professional organization for biomedical sciences, biomedical science, in the first, with approximately in around 20,000 members, or healthcare scientists, or laboratory specialists employed mainly in National Health Service, NHS, pathology laboratories, and some members across the globe. The IBMS is the standard sort of setting organization for the profession, and is also an awarding organization, an awarding organization of the certificate of competence that enables, for example, sciences graduates to apply for HCP, Healthcare Professionals Council, registration, and this, combined with its role as a provider for the biomedical science post registration qualification framework, makes the IBMS uniquely, or at least with some novelty, positioned to offer a sort of expertise and perspective on the service needs of the UK pathology laboratory services, and to offer a sort of a plan to offer a plan to develop a highly trained and qualified healthcare science, laboratory medicine, and pathology sort of workforce to meet the expanding and changing needs of healthcare service users safely, effectively, and efficiently. The IBMS, this IBMS document, a document in regard to the sort of workforce in regard to the healthcare science workforce can be identified through the IBMS's website, and it is a document that has been collated, linking aspects in regard to NHS England, the Royal College of Pathologists, and in regard to sort of some of the main principles aligned to good practice for scientists according to the Institute of Biomedical Sciences, and was a document a document that was originally sort of published and sort of launched in around 2023. That draws this audio podcast to a close. This audio podcast as part of a Newspart interlude. This audio podcast as part of a Ztorm and Squala. This audio podcast as part of a Ztorm Robotics production.